I'm here with Secretary Russell Redding from the Department of Agriculture. Secretary, can you tell us a little bit how COVID-19 has affected your department and how it's been operating?
Yeah, thank you. This has been a real test of the capacity of agriculture generally, the capacity of this department. Early on, we operationalized a lot of the continuity of operations plans to be sure that particularly our food system continued to function. And we take that for granted, right? I mean, we just assume it's always going to be there, but we never sort of look behind the stage, if you will, of all that's in place to make sure that from the farm to the distribution to retail all sort of works. That's been a really big part of our work the last 2 months.
So what would you say the status of the supply chain here in Pennsylvania is at this current moment?
Yeah, I think it is secure. Today, if you'd have asked a couple of weeks ago, I would say it was a really difficult spot. I mean, some of the national stories you're seeing today of food processing shutting down and difficulty with workers, we were there several weeks ago of just really trying to keep our operations running. Today, I'd say it's functioning, it's secure, it is less stressed than it was, but I think it's working well.
How is your department working with different farms and producers and people who are a part of this food supply chain to make sure that you are keeping this chain secure and available for people?
Yeah, thank you. And it's been an everyday worry. It's an everyday priority. The governor laid out early on sort of the expectations for us having the industry identified as life-sustaining and critical. And I think that was one of those early steps of both messaging to all of the industry of agriculture that we're important, right? But we also have an obligation, responsibility to deliver on our promise of food and food security. At the same time, as an important message out to the larger community about what was expected and of our farms and our food system. And I think that was one of the most important steps. Beyond that, it's been an everyday sort of worry to try to get the right guidance, right? You think about all of the touch points on the food system. It's both, at point of retail and point of purchase, which most of us as consumers know, but how do you keep that system working? So making sure they've got guidance on worker protection, make sure that our farm markets continue to work, all of the activity that takes place in distribution, guidance in terms of livestock markets. I mean, we don't think about how does livestock move through a system and around the country. So all of that's been the guidance, but most important has been the worker protection and making sure that they are prioritized, and particularly on the testing side, we've heard a lot about. So that's all been happening every day as part of our efforts here at the department.
Now we'll talk a little bit about the guidances that your department has issued in a minute. I do want to ask, have there been any disruptions to the food supply chain throughout the pandemic in the past 2 months? And what has your department done to address those disruptions?
Yeah, so the disruptions have occurred. I mean, they have occurred partly as a result of the nationwide, really global sort of stay-at-home orders that have completely changed the habits of consumers in the marketplace, right? So half of the food that we would consume pre-COVID-19 was outside of the home and the other half was in the home. So in the course of several weeks, we've moved from almost exclusively inside the house, right? 100%. So think about that in terms of just where we consume, what types of items we're consuming, the buying decisions we're making. That has been a disruption for sure, because if you go back into the farm, onto the farms and into the plants, they can't make those changes within a 2-week or less time frame. That's been a disruption. There have been some challenges on the milk and the fluid milk consumption as one of those results. You've heard a lot about this dumping of milk. That's been a disruption. There are export disruptions. There are meat supply disruptions as we speak today, although I think in Pennsylvania we're in a pretty good place, but nationally there are disruptions. And I hope that we haven't disrupted the confidence, though, of people about the food system. We try to really keep that in place. The business components have clearly been a challenge for us and disrupted along the supply chain.
Now, how has your department really worked to help solve those disruptions and to make sure that people are getting the food that they need during this pandemic?
Yeah, no, it's a really important question, and I think there have been a couple of measures that we've taken. One, some early calls that the governor and I did with the food industry, from food merchants to food processors to food banks, just making sure that we understood what they were seeing, the issues in supply chain or distribution disruptions that they were concerned about. What they were going to do to protect their employees and the workers was one of the efforts. The additional guidance we put out of priority testing, one of the only states in the nation that put out a priority testing within the mass testing sites in the Northeast and Montgomery County, which are two big hubs of food processing in Pennsylvania. So we put that out, made a huge difference in terms of calming both the employers, but also employees that needed to have that testing done with a commitment to turn them around very quickly. The guidance we've talked about a couple of times of just the individual sort of sector specific, whether it be the retail or our distribution system, the laboratory components, what we've done for schools, just make a list, and we've really tried to pick those off one at a time, but respond to those individual needs that they've had. And of course, Dr. Levine's order of worker safety has been the most critical, because you're not going to have a system functioning without people who want to function in it and who feel safe in it. That's really been critical.
Now, when you're coming up with these guidances, how are you working with people from the administration and working with stakeholders who are a part of this food supply chain to help make guidances that can work for everybody and keep everything secure?
Yeah, we have been constantly reaching out to our stakeholders. There's nothing that we've done in terms of guidance that hasn't been sort of spawned by a desire by the stakeholder group or the interest to have some resolution of an issue. Everything we've done in the administration, certainly the department, has included, our Department of Health and Dr. Levine and her team, the Emergency Management Agency and Director Padfield, on the food insecurity issue that has been, the Department of Education and Health and Human Services and Health. But all of those have been a collaborative effort with us. So I think we've worked well trying to triage the different issues that have come up, but we've really had to rely on the larger government to sort of find answers, because there's a lot of things that we're sort of the representative of, if you will, but the resolution needed to be found in other agencies like transportation, health, and labor and industry.
Is there a particular action either from your department or from other agencies within the government that has really helped to keep the food supply chain safe and secure, and something that you're really proud of to help keep Pennsylvanians healthy and well during this difficult time?
Yeah, if I could mention two, I think they're on just one is this the priority testing, because we were worried for sort of the first month of the COVID-19 about how to manage a critical system designated as life-sustaining, but at the same time had the same limitations that the larger healthcare system had in terms of how do you, if you have an asymptomatic or symptomatic employee, how do you get them tested and back into into the business and or out of the business if they need be. And two is, I think that I would point to the collective effort on food insecurity. The plan we released a week ago with the governor has been an everyday conversation with him about how do we make sure that nobody in Pennsylvania goes hungry in this crisis. Just last week, 500 and some thousand people went into the food banks in Pennsylvania. That whole system is an amazing network, and that's been a good collaborative effort with our U.S. Department of Agriculture, our other education, human services, and many people who've made that work. So people are getting fed, even in the most stressful of times. I think that's an amazing testament to both our public service work, but also the collaboration across the sectors.
And one final question. We've talked about stakeholders and we've talked about the people who are a part of the food supply chain, but what about the consumers? What can they do to make sure that the food supply chain is secure and that everybody is getting enough to eat during this really difficult time?
Yeah, we've said it from the beginning is I think be measured in your purchasing habits, right? I think we look around the stores and we see empty shelves, and I think all of us are, we're worried about sort of the supply and the availability of that. At the end of the day, it's about our own sort of habits. It's going to be there. The food system over 2 months has been stressed as never before, but I think at the same time, it hasn't disappointed us. Maybe we were restricted in the number of items we could buy, but I'd say to the consumers, that system is really, working well, but it is requiring a lot of patience on the consumer side. Be aware that we've had to move product that before would have been in the food service sector in the packaging. So maybe you see larger packaging of cereals or soups or eggs, as an example. That's all safe. It's there. It's been approved. And finally, I would just say that as we recover, to just be aware that the system will continually sort of refine how it responds to the retail sector. It's going to keep refining in terms of packaging. Our goal has been keep a steady supply, keep it reliable, keep it safe.
Secretary Redding, thank you so much for your time.
Pleasure's mine. Thank you. Stay safe.
PCN is committed to providing the people of Pennsylvania with the most up-to-the-minute information about coronavirus. Daily special programming with civic, business, and government leaders and how COVID-19 is affecting the community. Airing weekdays at noon and 8 p.m. Live special coverage of the Governor and the Secretary of Health, as well as programming designed to inform and assist everyone impacted. Go to pcntv.com for the latest information.
I'm here with Representative FrankDermody, a Democrat from Allegheny and Westmoreland counties. Now, you're the minority leader in the House of Representatives. How has the operations of the House changed due to COVID-19?
Well, it's been an interesting time. We've voting remotely for the first time, I believe, probably in history because of COVID-19. So that's historic, and it mostly works, although there are more in Harrisburg, I think, than should be, and it's a little nerve-wracking. But I think some of the things we've had to do are very important that we had to accomplish. So we're there, but we've had some votes that I think unnecessary and probably detrimental to us getting through this in a way that saves as many lives as possible.
What have some of those votes been on? What is that legislation that you don't think has been as necessary?
Well, mostly there have been attempts to open the economy piecemeal. And look, we all understand that great Pennsylvanians have made tremendous sacrifices to get us here. That we were in a position now where we had to mitigate circumstances, try to make sure that we kept the number of infections down so our hospitals could take care of those people who did get sick. And we have to be very careful and base our decisions on science, data, and the facts, and open up the economy in a thoughtful manner that's phased in and looks at where the infections are and what's happening with them. And, opening up certain segments of the economy, across the whole state at one point just doesn't make sense. And it flies in the face of all the recommendations from our public health experts, from not just Pennsylvania, from around the country and around the world.
Has there been legislation that the House has worked on that you think will be very helpful to the country, to the state, and to the counties as a whole?
We've worked together on getting us to come up and vote. We've worked on legislation involved with testing for the Commonwealth. We've given the governor the tools, some of the tools I think he needs to go ahead and help do his job, help protect the public safety, and get a path forward to safely opening up the economy again in Pennsylvania. So yeah, we've worked together. We try to work together. I think people expect us to work together. We should work together. We have a pandemic. We have a crisis like Pennsylvania has never seen before.
How important is it for both sides of the aisle to come together and work together on these issues?
Well, it's incredibly important because it's literally life and death. And while it has been hard, Pennsylvanians have made great sacrifices. And we've had to work through issues with the unemployment compensation system. I mean, there's been 1.6 million applicants for unemployment, and clearly they're behind, but they're working diligently to get that done. And we've worked together with Republicans to try to give them the tools they need to continue that work, make sure that gets done. They're working 24 hours a day, and they're making tremendous progress. So we will continue to try to work together with the Republicans, with the other side in the Senate and the administration and the governor to get this done. That's our job.
What are the biggest concerns that you've heard from constituents that you really want to make sure that you're addressing in the House of Representatives?
There's been several. Most want to stay safe, and they want to make sure that we don't open too soon. And people are saying, no, everybody wants to get back. They want to get back, all right. They want to get back to work for sure, but they want to make sure it's safe when they do. Unemployment compensation is really crucial, and it's serious. And we need to make sure that works for folks. And we are trying to make sure that happens. And we will. That will get taken care of. Those are the main concerns from folks right now. I mean, they anxious to get back to work, but they're also anxious to make sure they stay safe, their families are safe. We have child care issues. The schools are closed for the balance of the school year. So it's a complicated time for all of us.
Now, in late April, you released a statement about protecting Pennsylvanians' health insurance. Can you talk about the legislation that is introduced to help protect people during this really difficult time?
Well, as we speak, the Supreme Court, I believe, is taking a case up with the administration, where the Trump administration is suing to do away with the Affordable Care Act. And that's a real problem because under the Affordable Care Act, pre-existing conditions are covered. So if you had COVID-19, you now have a pre-existing condition. We have some bills that make sure that if the Affordable Care Act no longer exists, that Pennsylvanians who have pre-existing conditions are covered. And that's very incredibly important. We want to make sure people have access to insurance that's affordable. We want to make sure that their pre-existing conditions are covered in case the Affordable Care Act is overturned.
What about those individuals who may have been laid off from employment and now don't have access to health insurance? How are they being helped during this time?
Well, that's trouble. Medicaid will be available, and we hope they're able to apply for that. And the Affordable Care Act is there. And we've expanded Medicaid in the Commonwealth, so they should have access to health care. And many employers, even if they can't pay full salary, are covering health care for their furloughed and laid off employees. So it's great to see employers are trying. I know that. And everybody here is going through really trying circumstances. We all have to work together to get through this.
Now, you've talked about unemployment compensation and how there have been some hiccups in the system. How is the House of Representatives and the legislature working with the administration to help the people who need those benefits?
Well, all of us are getting phone calls. We work with the department to set up. So those who have applied, who were waiting the longest, we try to address them first. People have issues. We're trying to make sure that we're able to, because the legislative liaisons and those folks are overworked too. But they've added over 100 employees. They're continuing to train and add employees. The governor's going to keep doing that. So that's very helpful. We want to make sure people get their unemployment compensation, the extra $600. And we've added, a lot more workers, a lot more laid off folks who were originally not covered by workers' comp, who now are. And that's added a lot more people to the system. We have to make sure, working with the administration, that they have the resources to get the people, hire the people, and train the people they know to process these claims. So that, it's one thing to stay home, but you have to eat. You got to feed your family. We understand that.
Now, you're not only the minority leader in the House of Representatives, you also represent Allegheny and Westmoreland counties.
Right.
What is the situation in those parts of the state right now?
But, I guess we're fortunate in a way. We obviously have several cases, but Allegheny County, Western Pennsylvania as a whole generally has been spared to a certain extent compared to what's happened in the Southeast, in the Lehigh Valley, and the Northeast. Now, that's not to say you can let your guard down. And it's not to say it won't spread. This is some virus, and the more you read, the scarier it gets. So we've got to maintain social distancing. We've got to be careful. The governor has proposed and is implementing a plan that makes sense, that does it in phases, that does it by region, and evaluates the number of cases and the population. And I think that makes sense. We can open this up to a certain extent, but we can't be reckless about it, because all the experts say that if you are, it'll come back with a vengeance, and that's something we can't afford. And it would, all the sacrifices that we have all made, Pennsylvanians have made, would be in vain. And I just don't want to see that happen.
Now, talking about the governor's plan to slowly open up the state, there will be, I believe, 24 counties moving from the red phase to the yellow phase. Can you explain a little bit what that is and what your reaction to that movement is?
Well, I think it's a start in areas of the Commonwealth that have the fewest number of cases, and there's the fewest population too. I mean, however, it's mostly the rural counties but it's a start. Now, they still maintain social distancing, and they probably don't want to have gatherings larger than 10 folks, but you still need to keep the social distancing. I don't believe bars and restaurants will be open quite yet, but people can get back to work in a limited way and to see how it works. I think it also gives the governor the option that if there is a hot spot, that they can pull back a little bit. Opening just a wide open just doesn't make sense. And so I think this measured approach works. And, it also gives us a little test run that we can gradually open other regions.
For those people who really want the state to open up right now, who maybe don't agree with this measured approach, what would you say to them in favor of this measured approach and opening up slowly? We have who's made the greatest sacrifices here are those healthcare workers, the first responders, the folks who are on the front lines, the folks who are working in grocery stores that are open. I mean, they're risking their lives so we can get what we need to survive. And it's not fair to them to open this up in a reckless way that would start filling up hospitals. And let's protect them. Let's work with the system. Let's work with the governor. Let's work with the professionals. I'm no I can't even pronounce it. I'm no doctor, but an epidemiologist. And we need to rely on the science, the facts, the data, and make sure that we come back in a measured way that protects those workers that are out there and those first responders and those in the front line. They are the ones who are there risking their lives for us. We get reckless with opening this up. People get sick. People are in the hospitals, and the workers get sick. I mean, they are some of the bravest people you'll ever meet. They have suffered dramatically. We don't need to make it worse for them. Now, one final question. Is there anything else that you'd like to see from the administration and even from the legislature, your own body, to help keep counties and Pennsylvanians as a whole safe during this really difficult time?
Well, I'd like for us to work together. I'd like us to work together on an approach on opening up that makes sense. I think we can. That's important. We need to work with the administration and being open and transparent on all that we're doing. So the people of Pennsylvania have the confidence that we're making decisions that make sense for them, that protects them, protects their lives, and then we get them back to their livelihood.
Representative FrankDermody, thank you so much for your time.
Thank you so much. Pleasure.
Join our guests for insights on issues impacting local government and the citizens of Pennsylvania. Created by the Pennsylvania State Association of Boroughs, Inside Pennsylvania Boroughs connects you to legislation and policy that will affect you and your family. Your host, Chris Kapp, and his guests discuss current affairs that matter to you most. Connect with your state by tuning into Inside Pennsylvania Boroughs on Sundays here on PCN.
I'm here with Senator Bob Casey. Senator, can you tell us a little bit about the legislation that you are planning to introduce?
Yeah, it's a bill called the Pandemic Responder Service Award Act, and it's really inspired by the GI Bill, which was an education benefit that went to returning GIs after World War II, some 16 million at the time. What we're trying to do here is replicate that measure of gratitude and simply saying to those on the front lines of healthcare, the healthcare workforce, which goes across the gamut, folks who work in hospitals and home healthcare settings, folks who work in emergency services, people who are providing such heroic care and also exposing themselves and even potentially their families to the risk of contracting the virus. So we want to make sure that they have a benefit, which in this case would be a 4-year benefit that would be equivalent to the tuition at a 4-year public higher education institution, a little less than $10,000, and we would adjust for inflation over the 4 years. So they can use it to pay off student debt. They can use it to obtain additional, or for some cases, maybe the first time they've had a higher education opportunity. So we want to make sure that we're not just saying thank you and patting people on the back, as we should, but that we're giving them a tangible benefit for the sacrifice that they've made for their country.
Let's break things down a little bit. Who would be eligible for this program, for this benefit?
It's a range of categories under the broader umbrella of healthcare. Let me just read the list. Emergency medical service personnel, and that's defined in statute. Obviously, those who work in a hospital, and that would include not just nurses and folks in the room when they're providing care, but those who provide all kinds of services for that hospital, whether it's janitorial staff, transport staff, laundry, food service, all those. We want to make sure that we cover, of course, those who are providing care in a doctor's office, those who are providing home health care, and this is often overlooked. There's different categories under even that umbrella. Direct service workers are often overlooked. They work with folks who have a disability often working with children. Personal care attendants, home health aides, people who work in behavioral health services as well, and of course, those who work in nursing homes and residential care services, many of whom have suffered terribly, as have nursing home residents over the course of these last couple of weeks.
Now, you mentioned that the financial benefit would equal about a 4-year tuition at a public college. Can you explain how you came up with that number and why you decided to stick with that?
Well, because it makes sense. We have a number of states most states across the country have public institutions. That's where a lot of state residents get their higher education, and that benefit keeps it at the level of being, I think, a generous benefit, but not one that would run, $50,000, $60,000, $70,000 a year at some, if we pegged it to a private institution. But this is meant as an annual benefit over the course of 4 years. So that roughly, it's about $9,970 now, let's call it 10. That roughly $10,000 benefit would go to that individual in each of the 4 years. So roughly $40,000 over the 4 years. And we want to make sure that folks have an opportunity to use that benefit to pay off student debt or to obtain additional higher education. It would just cover a public university type education. It could also include vocational or technical training as well.
So when do you anticipate this legislation being introduced, and when could the Senate be taking it up?
We're trying to finish it so we can get it introduced this week. And we want to make sure that after we introduce it, then we begin to gather bipartisan support. There are a number of folks in the House and the Senate who have talked about having legislation that would help our frontline workers. And I've been supportive of a separate but different piece of legislation called the HEROES Fund. That would cover the range of frontline workers, not simply healthcare workers. I think if you're in healthcare and you get a pandemic premium pay, as we call it, or some people call it hazard pay, this education benefit would be on top of that for those frontline workers who are in the healthcare sector. I think they are literally at the front of the front line, those who are providing such heroic care, but who are most at risk.
Now, this is a benefit that focuses on the education for our frontline health workers. Right. Why did you decide to focus on the education of these workers?
Well, because that's obviously going to be one way that they can advance their own career and help them be more economically secure over time. It also helps the rest of us. If you take out the GI Bill from our history in the 1950s and 60s, we would have a middle class which would be in a lot worse shape than it would have been in the decades since. The GI Bill helped build the middle class. This will help as well. But we also want to give them the option to say if they want to use the dollars for to have a startup, startup business development, use it for that, or for a home, another expense. Or to transfer it to their children for future savings. We want to leave it up to the individual in a set, kind of an itemized list of uses. But I think the main use for most will be for education purposes.
And why was this such an important piece of legislation for you to come up with and to introduce to the Senate?
Well, because we've all been moved by the stories throughout Pennsylvania and throughout our nation of these heroic individuals. They are literally soldiers on a battlefield in a war against the virus. And there's no way to, in words, to express our gratitude. But we have to do more than say thanks and applaud them, as many people do at 7 o'clock every night. There has to be a tangible manifestation of our gratitude, which also happens to help that individual over time and helps our economy at the same time. So we want to make sure that we have something tangible, and this is one way to make that real, to manifest the gratitude we should express to these heroic people.
How do you anticipate this affecting the healthcare workers here in Pennsylvania?
Well, there'll be a lot of workers in Pennsylvania who can benefit. We don't have the exact numbers yet, but there are tens and tens of thousands of people every day who are leaving their homes, going into a hospital, going into a nursing home, going into a whole range of care settings to provide care and putting themselves at risk all throughout our state. We have to make sure that we express our gratitude in this way.
If this bill were to pass through the Senate, the House, and be signed by the President, when do you anticipate it going into effect, and when could people potentially start seeing these types of benefits?
Well, we want to make sure that anyone who has provided this kind of care, even over the course of just a week, 7 days of work, but it's really meant to help those who, and we focused on the top level benefit being 180 days. So obviously, I think we want to make sure that it's available for folks in the next few months, but certainly it'll be most beneficial to them when they're beyond the crisis, where they're not working the kind of hours they're working now, and that the virus has receded. But obviously, when they get a little bit of a window of time, a break, that's when we want to make it available to them, when they can use it most effectively.
Now, have you received any feedback from your Senate colleagues, and how will you go about getting bipartisan support for your legislation?
We're starting to, just beginning it, because for a lot of people it's a new idea. The concern I have is that because there's some bipartisan, or I should say there's a little bit of a breakdown in bipartisan support for a range of policy matters that should be addressed in the next bill, what people are calling COVID-4, but it really would be the fifth bill if you include the interim bill from 2 weeks ago. But in this next bill, we're going to cover a range of issues. There might be more small business help. Unemployment insurance could need help again. Payments to families could be on the table, as well as food assistance, Medicaid, a whole range of issues. But as part of that, I hope that Republicans would join Democrats in this effort, both on the Heroes Fund, which is broader and covers many more Americans, as well as the pandemic responder bill that I have, because this should not be an issue that divides the parties. What I worry about, though, to be candid with you, is some are saying in the Senate, and even the administration has expressed some of this a little bit, that we have to stop legislating, that we've legislated enough. And I think that would be a real mistake, not just in expressing our gratitude tangibly to these frontline healthcare workers, but on a whole range of other issues. We still have a lot of work to do two things: to deal with the pandemic itself, the virus, and the ravages of this virus, and secondly, of course, to deal with the aftermath, the horrific aftermath, the economic consequences that so many families are already feeling. We got to deal with both the public health crisis and the economic crisis.
Senator Bob Casey, thank you so much for your time.
Thanks for your time.